Could you see our screen?
Yes, we can.
Perfect. Well, I'll turn it over to April Baker at this point.
Hey, everybody. Can y'all hear me okay?
Yes.
I'm in the same room with Kevin, so I'd assume so. Hi, everyone. I'm April Baker, and I'm Vice President of Intake and Outreach with CDS in Texas, and we're an FMSA for the CDS option, a financial management service agency. Kevin Jeffries is also with me. He's VP of Operations, and today we're going to do an overview of EVV in the CDS option. This presentation is a general overview of EVV and will not go into detail on the EVV platform itself because every FMSA chooses what company in the state that they're going to use EVV with. There's two companies they have that everybody can choose from, the FMSAs, but we went with Vesta. I don't know what other ones, which one your FMSA may have chosen. The HHSC website also has some training available for the EVV that's going to happen soon. We do not represent HHSC. We'll take all of your questions in the chat box. And then your questions may be answered throughout the presentation. We have a whole frequently asked questions at the end that we've received from clients.
All right, so we'll get started.
Okay. So CDS and EVV overview. What is CDS? CDS is Consumer Directed Services, is a service delivery option offered in Medicaid funded programs. CDS is meant to empower the individual or that person's parent or legally authorized representative to hire their own employees and manage their services while living in their home. What is EVV? EVV is electronic visit verification. It's a computer-based system that electronically verifies that service visits occur and documents the following visit data. The system documents the program provider, the FMSA, and the individual providing the service, the employee, the type of service that's performed by the employee, the individual receiving that service, the date and time the service delivery began and ended, and it also documents the location where services are delivered. Where is EVV coming from? Why now? The 21st Century Cures Act is a federal law requiring the use of EVV for all Medicaid personal care services. Texas must implement EVV for personal care services by January 1st of 2021. HHSC already requires EVV for about 90% of Medicaid personal care services already. Individuals using the agency service delivery option currently do use EVV already through their agency. The difference in that is the agency is the employer and sending attendants out to the home, and CDS is not the case. The employer is the client or the legal guardian that hires their own attendants to come into the home. The Cures Act requires states to use EVV for all personal care services to continue to receive federal Medicaid funds.
So as far as the timeline, we're currently in the practice period. It started on July 1st. Every FMSA is going to approach this differently, whether they're choosing to try to start implementing and getting employers clocking in and out as of July 1st, or they started the implementation as far as getting integrations and processes in place. So for every FMSA, it's going to be different. If you haven't heard anything from your FMSA, we would encourage you to reach out and have a conversation with them as far as what their key dates are. But as far as CDS in Texas, we began on July 1st, and we are currently working on getting everyone set up with usernames and passwords and access and getting employees set up and linked to everyone. And we plan on beginning punching in and out in the month of October and November to be ready for it in December. So if you haven't been receiving, if you're with us and you haven't been receiving emails, please call our office so we can get you on our email list. Because we are sending out important reminders to everyone, but we're also sending out phone calls, and we are going to be starting a phone call campaign to where we discuss EVV with everyone. So between July 1st and November 30th, there's several milestones that FMSAs need to hit during that, and like I said, it's different for every FMSA. The next important date with the EVV implementation for the 21st Century Cures Act is December 1st. And that's the official go live date that HHSC has set. And what that means is that from that point forward, all items data service December 1st forward have to go through the EVV system. The repercussions if that doesn't happen is that your FMSA wouldn't receive reimbursement for the payroll being paid out because there's nothing for their claims to match to. So it's very important that you are clocking in and out, so therefore it doesn't disrupt any type of payroll.
Some of the services that are impacted by EVV, here's a list of them. EVV, not all services are going to need to be called in and logged in the EVV system. EVV required services is CFC habilitation, okay. CFC habilitation non-waiver and waiver, CFC pass hab, your CFC personal attendant services, day habilitation that's provided in the home, flexible family support, in-home respite, MDCP. If you only have nursing through Star Kids MDCP, you do not clock in for EVV, but you would have that discussed. Your FMSA would talk to you about that. Nursing is not included. And personal care services, personal assistant services, protected supervision in Star Plus. That is, you're going to call in with EVV and respite. Some non-EVV required services that you're not going to use EVV for. Transportation. I know that that's something we'll get into in a little bit during this presentation. Transportation is not something you're going to use EVV. You're going to send a separate timesheet in for that. And then behavioral support is not covered, is not needed to use EVV. Community support, employment assistance, supported employment, intervener, dental treatments, support consultation, adaptive aids, value-added respite is not going to be EVV, and out-of-home respite and day habilitation that's provided out of the home. Those are a list of the ones that are not going to be required to use EVV.
So moving from the services that are required and not required, a lot of you have probably seen or heard about Form 1722. It's been in existence for quite some time now, but before it was simply an opt-in or opt-out of EVV. The state has gone in and revised it to encompass the EVV after 21st Century Cures Act. So it looks different. And with this form kind of governs how the FMSA is going to interact with you. And if you notice, if you've reviewed it in its entirety, it does have verbiage as far as who's responsible for what and what option you can select to how to utilize EVV and interact with it. It's broken down into 3 options, option 1, option 2, and option 3. And we're just going to do a very high level overview as far as what that actually means to you. Because one thing that we have learned with implementing EVV and corresponding with clients is that individuals are having a hard time distinguishing which option fits their needs the best. Because some of them may have technology limitations, some of them may have time limitations, some of them have different limitations, so therefore one may be better for you than the other. And so we're going to kind of go over each one from each perspective, from the employer's perspective, the employee's perspective, and the FMA's perspective, in order to kind of give, you know, an overview to help with your decision if you haven't already made a decision, and we'll move forward. So as it pertains to 1722, from the employer's responsibility, if you were to be an employer and choose to go with option 1, what that means for you is that you would need to train your employees on how to clock in and out. You would also need to complete initial and annual CDS employer EVV training. You would also have to perform what they call a CDS or EVV visit maintenance within your system. And we'll go into a little bit more detail about that here in just a moment. And then you also need to approve the hours for the visit maintenance that you have completed within the system. So before we move forward into the option 2 and option 3, just a quick overview of what visit maintenance is. Visit maintenance is simply working the punches that are within your system to make sure that the services are allocated appropriately, things are documented clearly, so therefore when they're transmitted to the state knows how services are utilized. So once you perform the visit maintenance and it truly reflects what the services were worked within the home, you would then have to go in and approve those visits, so therefore the FMSA knows that you are ready for payroll to be processed. So option 1 really puts you in control as far as how the services are being utilized, how the services are being communicated. Option two is kind of a hybrid between option 3 and option 1. It's one of those options that we're not really encouraging all consumers to really go to. If you choose to, that's fine. Just because of the back and forth, because the hybrid between the two services, it sometimes can lead to delays. But with option 2, you still have the requirement to train your employees on clocking in and out. You still have the requirement for initial and ongoing training for CDS or EVV, I'm sorry. And then you still have to approve the visit maintenance after it's been completed by the FMSA. So what's different between option 1 and option 2 is that you would tell the FMSA what was worked within your home. We would do the visit maintenance, and we would see your employee clocked in and out and what they didn't clock in and out, and we would add those into kind of your interface, and you would go in and you would confirm that this is correct, I'm approving it, and it would go back to the FMSA to be paid in payroll. So the reason I say that it's a hybrid and sometimes could lead to delays is that you would still have to send us some form of documentation telling us what was worked within your home. We as the FMSA would still have to go into the EVV system and add what was missed, punched by your employees, and then we would still have to send it back to you for approval. And then once you approve it and it comes back to us, then we would be able to move forward with the payroll processing processes. So then you have option 3 from the employer perspective. Again, you still have the responsibility of training your employees on how to clock in and out. You still have the initial and annual CDS EVV training. But what is different with this one is that you are submitting a document to us of the hours worked within your home. What that means is you're telling us what to do and how to do it. So for example, if an employee worked past half and they worked respite and you have the times, we will simply go into the system, we will input that into the EVV system, and then we will approve that. So it's very similar to our current process where you submit a timesheet and it's one directional. The only difference is that you are still required to have your employee clock in and out, and then you would still be required to submit some type of schedule or timesheet to us, and then we would fill in the blanks. And if those employees failed to clock in and out, we would have to notate in the system that the employee failed to clock in and out, and you would have a conversation with your employees on why they're not utilizing the system to clock in and out. So that's kind of an overview from the employer's perspective. Now we're going to move to the employee's perspective. If you notice, every bullet point is the same because all the employee is required to do is clock in and out and receive training from you, the CDS employee, on how to clock in and out. And that's the same through all option 1, 2, and 3. Really the difference between EVV and the processes prior is the engagement between the CDS employer and the FMSA. The employees, the big change is they'll just have to clock in using a mobile device, an alternative device, or through a home phone. Now from the FMSA role and responsibility perspective, for option 1, we use the final approval to make sure things are within the authorization, services are being utilized accordingly, and we have to submit to TMHP, which is kind of a database repository for all the punches that HHSC is contracted to keep, and it's also called the aggregator. Some of you probably have heard that term. And then also train the employers, the CDS employers, on EVV policy initially and annually. So not only do you all have to conduct an initial EVV training for over policy and over the EVV system, the FMSA is also responsible for doing it annually. Now for option 2, you still have the final approval and you still have the training, and you'll see that kind of duplicated down below. The only thing that's added to it is that now we have to do visit maintenance on your behalf. So that's where you have to submit documentation to us saying what was worked within your home. And then option 3, as we covered briefly from the employer perspective, is that you still send us the documentation and you will communicate to us what has worked, and we will perform visit maintenance on your behalf, but we will also approve it on your behalf using the documentation that you submitted to us. And again, that's similar to the current process. The only difference is that your employees are required to clock in and out using an approved EVV method. So that kind of takes us to the end of the overview as far as the 1722. What we're going to be doing from this point forward, we're kind of going to go into frequently asked questions to kind of, keep the conversation going, and to maybe put some questions out that we received from some of our employers that maybe you haven't been thinking about, or maybe you have, and this will answer some of those questions. And so I'm going to turn that over to April.
In the chat, I see that somebody was asking what visit maintenance is. Let me address that. Visit maintenance is when the employer goes into the EVV system on a website, not an app, through the website on a computer or their smartphone, and they verify that all of the hours that their employees worked are accurate and correct. And there's a process for that. It depends on, of course, like we've said, what system you're in, but as far as how Vesta works, it's not difficult. You go in and you just verify that, yes, my employees worked these hours, and you verify. And then we get a notification that you've verified time, and we go in and we look at it and we process your payroll. That's option one, where you're in control. You can get that done quickly after your 2 weeks of time. This is how our payroll is. Every 2 weeks, that's when you're going to be clocking in and out, and then the payroll, we process those last 2 weeks. But that's what visit maintenance is. It's just a big word for it's the same thing you're doing now. You're going over your timesheets and making sure the paper timesheets, and you're making sure that those hours are accurate for your employees so that you stay within budget. So let me see if there's any other, you see any other?
So another question is if there individuals asking if PassHab for HCS is included with EVV required, and yes, it is. And I also see that they said it's not included on the list. So we tried to simplify the list, because when you're looking at the document from HHSC, it can be a little confusing because they have it by program, by service. We kind of layered it by service, and we will make sure we get that corrected before we send out the actual PowerPoint presentation. But yes, PassHab is required to use EVV. So another question that comes up quite frequently, and I do believe this is one of our FAQs, but we'll go ahead and answer it. It says, how do we pay bonuses and sick pay or a gas allowance? Do we submit a timesheet for that? We cannot speak for your individual FMSA, but we can speak for our FMSA, and we are going to be requiring a timesheet as you normally would for non-EVV services. So those bonus payouts, the sick pay, gas, transportation, those services, we're going to encourage them in order to submit a timesheet. And the reason we're doing that is in order to avoid confusion. Because within this EVV system that we're using, there's not a good solution to keep track of your EVV services and your non-EVV services. And it gets quite confusing. And when you have a lot of services as far as transportation, things can start to commingle with one another. So we are actually asking, or will be instructing our employers to submit separate timesheets for those non-EVV services.
I'm going to go back to the slide, but we'll be looking at the chat for questions. One question, these are just questions that we get a lot from our clients. What if my smartphone is not working? How do I clock in and out? We are recommending that all clients request an alternative device. And requesting an alternative device, in our system at least, we can do that for the client. And we suggest everybody has an alternative device. It's also called a fob that stays in the home, and it generates a unique number every minute to designate what time it was. So the system knows, oh, that's the number that equals 8 a.m. or however. And so we recommend everybody gets that, because you don't know what'll happen. You might lose your phone one day. It's just easier to have that in the home for a backup way to clock in and out. That way employees can clock in and out when you request that device, the alternative device. Employees can clock in and out when they're unable to use a smartphone or a landline. Also, please keep in mind that you can clock in and out on your smartphone even if you're out of range of service. So one of the ways to clock in for EVV is through the mobile app. So if you have an iPhone or an Android, you can download the app for the EVV vendor. So you can clock, if you lost service, you can still clock in, and it'll register later on when you get into an area with good cell service or Wi-Fi. It'll log what time you clocked in and what time you clocked out if you never had service the whole time. So it will register. Another thing to talk about is, how does it work for clocking in for different service types. The selection of service type happens when the employer is performing visit maintenance or when the employee is clocking in and out using the mobile app.
Right, and so we actually have a question within the chat box that touches on this. And the question is, how would the FMSA know if the hours are respite or CFC? Another question is, how would the employee know whether it's respite or CFC? So with the EVV system, we are encouraging you to download the mobile app because it allows you to make selections between services. So very similar to currently, you have two timesheets, one for your respite, one for your CFC or your pass have, and you fill them out separately. Well, with the mobile app, you would simply be clocking in and out between those different services. So when your pass have shift is over, you would clock out. And if you're going to turn around and begin a respite shift, you would turn around and click the drop-down box for respite and clock in respite. And I know that that's a feature for Vesta. I cannot speak to First Data Solution, but for Vesta, they do have the ability. It is now being pushed out to the mobile app as of October 1st, allowing the attendants to select those services. Now, if for some reason, if your attendant selected the wrong service, you can change the service while doing visit maintenance. It's simply edit the visit, and at that point, it'll ask you if you want to change the service. You can change the service. You can also change the time in and time out. You do have full control. Now, all you have to do is simply document why you're doing what you're doing and hit save and move forward. But to answer that question is you would need to use the mobile app to show the difference between the services. If for some reason, if you're using the landline or you're using a token as it pertains to Vesta, you would have to do visit maintenance if you're going between different services because it's going to default to the primary service. And then that secondary service, such as respite, you would have to go into visit maintenance and say which of the pass have services actually were respite. So it's very important that you do have a good clock in and out process. So therefore you can isolate your shifts between the two to make it easier to change them within visit maintenance. So we're going to move to the next FAQ and we're going to continue to monitor the chat box.
Let's see. Okay, the next one is if I am using an alternative device, also called a fob, also called a token. Kevin just said token, so that's another word it's called. How often do I need to log the clock in and out codes? You should call this information in every day. So if you're using that fob, an example is you have that alternative device in the home and there is no landline, and you don't want to use the mobile app, which is the easiest way to go, using that mobile app. But if you're not able to, you would use a cell phone and call in, and it's going to ask you for the number that's on the alternative device. And you should do that immediately. You can write the numbers down for when you were going to clock in and clock out and call them in later. You can do that, but that's not something you want to practice daily. That can build up, and then your time can run out to enter those hours. This data is only retained for 7 days. If you do not register the data daily, you risk losing a record of your hours. And that's just one of the ways to clock in.
And let me state that as far as losing a record of your hours, you can technically go in and enter those lost digital numbers within visit maintenance. So your employee won't lose those hours, but what it will happen is that you'll go from having a an actual punch in and punch out that passes, compliance, to doing visit maintenance and having to do a justification as to why your employee didn't clock in and out. But you don't technically lose the pay or the hours for your services to the employee. It's just that code is no longer useful after 7 days. Sorry, April, go ahead.
Okay. Is it the employer's or the employee's phone that should be used to clock in? If it is the employer's, how will that work if employer is away from home while employee is trying to log in? If the employer has a landline that may be used to clock in and out, the employee can go to the home, be with the client, start working, and use that landline. You just call in, you put your employee number, the client number. You don't need your alternative device for that. The landline is registered with the EVV vendor, and it understands that you're clocking in and clocking out from the home and you're with the client. So That's one way to clock in. If the employer has a landline, that may be used to clock in and clock out. The employee may use their own smartphone to clock in and out using the mobile app, or they can use their own phone to call in a code produced by the alternative device. The employer may also let them use their own smartphone to clock in and out using the mobile app if the employee does not have a smartphone.
And so to clarify on that, that means that if your employee didn't have a smartphone, and you really want to take advantage of being able to select the services, and your employee is, savvy enough to be able to use an app, you can actually download it on your own smartphone, because they have a unique username and password to log into Vesta's mobile app or to First Data Solutions mobile app to know who is logging in and to clock in for those services. So to kind of get to some of the questions that we have coming in the chat box, one of them is, how are you handling grace periods? If someone arrives early or late, are you paying from the minute they clock in, or are you rounding to the nearest 15 increments? So that's where it kind of gets tricky with EVV, because you have to separate hours, which you bill to the state, which there is a rounding because you convert to a unit. But I think you're primarily speaking as far as the employee's pay. The CDS in Texas, and you may want to speak with your FMSA about this, we pay by the minute. We do not round up or down. We take the actual punch in and punch out, and we pay by the minute. So therefore, your employees are not losing any of those pay. And we also have uniform processes. I do know that some FMSAs do choose to do rounding, and that's okay. That's a business decision that they do, because they round up or they round down, and it ends up working out. But as far as CDS in Texas, we pay by the minute. We do not round up or down. We are going to work on getting a copy of the slide. We'll work with parent to parent as far as where to publish it. Another question is, so in maintenance, if employee works one shift, you can go in later and adjust CFC versus MDCP. If those are your two eligible services, absolutely. If they'll say they clocked in as MDCP and it should have been CFC, you absolutely can do that. But let's say also they forgot to clock out for the other one, and they forgot to clock out of CFC and they worked just one long shift of MDCP. You can actually end that CFC shift early, and then you could create a new shift using manual visit and create a new shift where MDCP technically were to begin and end it where it should have ended. And all you have to do is do that, and then you'll document as to why you did it and save it and approve it. How often is visit maintenance done? Daily or at time of paydays? We would recommend that you do it as frequently as you can within your home. Every home's different. So doing it daily, someone may say that that's too much time. They don't have enough time in the day, and I want to do it weekly. I would recommend that you doing it at least once a week, because of your 7-day rule with your alternative device, to make sure your employee's entering them. But daily, you could absolutely do that. So therefore, it's a little bit each day versus a lot at the end of the week. But you would run the risk if you do it once every 2 weeks, is if your employee isn't doing what they should be doing for the alternative device, you could have lost that token or that alternative device number, and that means you'd have to manually create a manual visit for each one of those missed punches.
But we're pulling the information out of EVV every 2 weeks like we do anyway, and to process payroll. But keeping up with it daily or at least weekly would save you some time, instead of coming up on that end of the 2 weeks when the verification is due, and having all of this work to do and verify. It's just best to not wait till the last minute, of course. But
next question before we go to the next slide. This is a good one. It says, what if an employee works for 2 people in the same household? For example, 10 to 2 for one person, 2 to 4 for the other. Can they use the same app under the same email address? Absolutely. So within the Vesta system, I can't speak to the First Data Solution, but I do know that they are governed by the same rules from HHSC. You can use the same mobile app. And so within the Vesta app, you have a list of your employees that that employee is responsible for in the services. So what would happen is they would clock out at 2 o'clock for person 1, and then they would at 2 p.m. clock back in for person 2, and then continue the shift until the end.
in Vesta also, you don't need to clock out at midnight. It records
Correct.
the day you clocked in and the day you clocked out. You don't have to clock out at midnight. I know that's a question we've received. At least with Vesta, you do not have to clock out at midnight and then clock back in because it's a new day. Are separate clock in outs required for different services, pass and respite, et cetera? Yes, we talked about that. The employee must clock in and out when changing services or the client, or you can go do that and visit maintenance if it was, if someone did not clock out when they started working, they were working pass and then they switched over to work respite. Or they might have been working the PCS hours for Star Kids and then worked some respite hours. Yeah, you do want to clock in and out, but the employer can go fix that in the visit maintenance. If a change in employee schedules is required, would employees' hours be locked in, or will there be an option to manipulate them and maintain a flexible work schedule?
So yes, absolutely. So within the CDS, and this is one of the complicated reasons why it's taken so long for EVV to come to the CDS group, is because the CDS program is meant to empower you. And the way to empower you is to give you flexibility in order to utilize services how you feel that they should be utilized. So what that means is that if for some reason, if the employee clocked in with a different shift, or they forgot to clock in, or someone came in at the last minute, there's not a rigid schedule you have to follow. You can pretty much add and remove visits within the system in order to represent what actually happened within the home. So don't be afraid of a mistake. It can be corrected. And also don't be afraid if you have to call someone up because another attendant called in at the last minute. There's not a schedule you have to go in and edit. They simply show up at your home, they clock in like they normally would, and the system will accept it. Or if they show up and they forget to clock in, no big deal. You can simply go in and do a visit, a manual visit within the visit maintenance system, and continue to be flexible within your home. So we do have another question. It says, I'm actually with CDS in Texas and I've done the Vesta online training, but I haven't been able to request a alternative device because it says not active. So that is something that we can work around. We are actively working on implementing, and we are bringing individuals on in groups. So if you could just email evv@cdsintexas.com and address it to myself, Kevin, we'll work with you on that, and we'll get you moved up. But yeah, we just have a list that we're going by, and it just could be that we haven't turned your account active, and then we can help you with that. So next question is, there are many Vesta apps in the App Store. Which one is the one for EVV? That is a really good question. I believe it is the one that is labeled for Data Logic. It's called Vesta Mobile for the Apple iOS. I'm not speaking to the Android iOS. And it's called Vesta Mobile. And
it's not going to be anything you have to buy. It's free.
So it's a free app, and it's actually, the publisher is Data Logic Software. So when you're looking for, look for Vesta Mobile produced by Data Logic Software. That's it. We're pulling it up on our phones as we're discussing with you.
Has 3 stars and there's 88 reviews on it. So that's the one you pick.
All right. So the next question before we go to the next slide is, where can I find Vesta training for your company, CDS in Texas? So that's a very great question. In fact, if you want to go to cdsintexas.com, there is EVV link pop up on the main page where it'll give you how-tos, links to training, videos. All those things are frequently asked questions that we have. So feel free to go there and download it. Or if you'd like to speak with someone within our office to get that for you, you can email evv@cdsintexas.com, or you can call our main number and speak with our customer support department.
Okay, next question on our slide is the mobile app. Can I clock in and out while my phone does not have a signal or access to the internet? Yes, the Vesta or the mobile app will allow you to clock in and out while offline. Once your cell phone registers a signal or access to the internet, your punches are going to sync with the system and be logged, and then be ready for the employer to do visit maintenance later on. I do not have a landline or a smartphone, and I am the CDS employer. Am I able to use my employee's smartphone in order to approve my employee's hours? Yes, you can utilize your employee's device or computer that has access to the internet to approve your employee's time. You will have your own username and a password to the EVV system. We would recommend using a computer over a smartphone if possible to perform visit maintenance. I think it's just the size issue really, that it's just harder to see all the check boxes you're going to have to do with all the time, the punches in and out. So, it's up to you. If you're fine using a phone to do it, that's your decision.
Yeah, but I would recommend kind of playing with to see how the screen looks, whether it's landscape or portrait, to see if you have enough visibility in order to navigate it, because that is a big difference between a computer and that. Another question we have: Do you have to use one parent's smartphone? What if parent or the father is a DR in his home and mother, who is employer, is out with the caregiver, checks in? So because the employee has their own unique username and PIN number, they can technically access any smartphone, whether it be your smartphone, the DR smartphone, the child's smartphone, or just a iPad or Android tablet that's set up within the home. If it has access to the internet and it has the Vesta or the First Ad Solution mobile app, they can clock in because they have unique usernames and passwords for that employee to authenticate that that is who's clocking in and out. Next question is, how about if I want to control when they sign in and out? Can they just do it on my phone? Have them always do it on my phone or iPad in the home? So that is where it's your choice as the employer. You can choose what they're using to clock in and out. You can choose where they're clocking in and out. And that is within your control as the employer in the self-direction of the services. I'm gonna have to sit through the other questions back and forth. So let's go to the next slide.
Okay. You want to look at the chat then?
Yep.
Okay. Another question is, can each employee choose a different way to clock in and clock out? Yes. Each employee can choose a different way to clock in and clock out, or the employer can choose the way they clock in and clock out. The employee can also use different methods. So let's say the employee comes to the home, uses the landline, clocks in. Then later on, you're out in the community with the client. Y'all went to the park. Somebody meets you there. Y'all switch out. Then another attendant comes. That employee would clock out on their mobile device using the app. That's a way that's a scenario that could happen. You don't have to use the same way to clock in and clock out. That's your option or the employees that you give the employee. So the next question is, does it mean no more timesheets? Timesheets are still required until December 2020.
And let me put a indicator on that, is that HHSC is still working with policy and program rules, because some of the paper documentation comes from a program rule perspective. So HHSC is still working on that. But as of right now, timesheets are required for all programs, and it could be that some programs no longer paper documentations are required after December 2020. And we plan on notifying our employers of that whenever HHSC comes up with the formal guidance. Sorry, April.
That's okay. Okay, so timesheets are still required. And if you have done the training and we get you set up in our system, Vesta, if you're with us, it means no more timesheets if you choose option 1 after the testing period between July and November 30th is over. If you choose option 2 or 3, your employees will still have to log in electronically using either the landline, the mobile app, or calling in on a cell phone or a phone in the house that's internet-based using the token. They're still going to need to send in a timesheet if you choose option 2 and 3. You're going to send the timesheet to us. We are in the process of designing a timesheet for this purpose. It may be necessary for this timesheet to be sent back and forth multiple times before it can be finalized, because you're sending it to us, then we go in, we have to look at everything, verify that your timesheet matches the punches that are in the system that the employee did. We're still working with HHSC to reach the simplest process, which still meets their requirements.
Great. So we have another question. It says, how does daylight savings time work within overnight shifts? So with Vesta, and I cannot speak for First Data Solution, but with Vesta, the system automatically clocks out at midnight and clocks back in. So therefore, it has the ability to adjust back an hour whenever you have that, or roll forward an hour. And the systems typically will handle that. Your employee will simply work as they normally would. They would not have to clock in and out in order to adjust for that. Next question says, are times with MDCP that I under budget some weeks and then over other weeks, will EVV allow for this situation? Yes, EVV is not impeding upon program rules and the rules around utilization of your services. It's simply just documenting how those services are being performed or utilized. So therefore, any program rules, you would still follow those rules, and it should not inhibit you from utilizing your services.
Yeah, we still see this information. We get it. We compare it to your budget that you have. And if you're allowed to bank hours and use those in the future, that's going to be processed. And of course, if somebody overworks and you're not hitting your budget, you're going over, we're going to contact you to have a talk about that. But yeah, that's not affecting those types of issues.
Okay, so we'll do one more question before we go to the next slide. So clocking out seems cumbersome, especially for visits which involve several different types of services in one visit. Take time away from working with participants. Can the employer record the changes in services at the end of the shift or later? So yes and no. And the reason I say yes and no is that EVV is meant to acquire electronic punch. So what that means is that the state is going to be focusing on your employees punching in and out electronically to replicate or communicate how services are being performed. So what that means is if they are going between different services, different children within the home, or different members, they would have to clock in and out between those services in order to have a electronic device capture that. Now, if for some reason, if something is missed, something's going on with the member at that point that, where you can't leave the member, at that point, you can make the decision, look, I want you to stay by the member. We will adjust your time after using visit maintenance. You have that option. But the state is wanting to have as many digitally acquired punches as possible, and as small amount of manual entries as possible. There are technically no compliance guidelines written for CDS as of right now. They are working on that, and those will be coming in 2021. But I would imagine that it would be something along with how much the percentage of your employees clocking in using a approved device and the percentage of how much is being done manually. So you do have the flexibility. If for some reason something's going within your home where you want to make that judgment call to say, no, I don't need you to leave the bedside, we'll adjust your time after, you can do that. But just know that the state is wanting to have as many punches as possible come from an electronic device.
Okay, next question. Can funds in the budget be used to purchase a smartphone? Yes, but funds must be allocated to your budget. You have to set them aside in your budget. At present, the limit is $600 per program year. HHSC is working on increasing the amount of funds that can be used for equipment and supplies. HHSC has stated they will be allowing the employer to purchase items to help with EVV, but have not given a formal list. Currently, you are able to purchase a computer or an iPad as long as it's only for CDS use. So buying a smartphone for your employee, I wouldn't suggest that. But if you need a device to be able to go on to the EVV platform and verify the punches that came from your employee, that is something you can call and talk to your FMSA about allocating money in the budget for those things. I'd like to know when the training will be sent out for the new EVV clock in, clock out format. You will be prompted to go through training when you first log into the EVV user portal. And that's again up to your FMSA when they give you your information that after you send in the information we need from you. That's a conversation to have with your FMSA. And if you're with us, you can reach out to us, but we will be getting in contact with you soon if we have your information about EVV. When does EVV start? I do not know how to get my employees' times paid out. July 1st started the official testing period that will run until December 1st. We'll begin utilizing EVV before December 1st, but are still in the information gathering period. When we're ready to begin, there will be an official notification sent to all clients. Please continue sending timesheets as normal.
And just note that is for our organization because it is a rolling implementation period. So every FMSA is different. If you haven't heard from your FMSA, I would encourage you to contact them and try to understand what their timeline is so you can make sure that you're prepared. Back to the questions. We have one question that says, what if an employee works till 2 a.m.? Will the system capture the carryover from the next day? Absolutely. So I can only speak to Vesta, but I do know that this is a standardized rule that HHSC has said that they have to do. But Vesta will clock you out at 11:59 and clock you back in at midnight to help with that carry forward or carry over to the next day. Next question is, can there be more than 2 devices registered per client? I have more than 2 employees. So you can actually have more than 1 device used to clock in and out. So what that means is that you can have a landline that punches in and out for 2 employees or 2 clients and 2 employees. You just have a different EVV ID. You would have to have 2 alternative devices though, because alternative devices are registered to the employees. And you would also, if the employee is using a mobile device in the app, you can select between clients in order to clock in and out between clients and services. Says I have, next question is I've completed the form and received an email stating that I should be receiving an email from Vesta within several days. It has been over a week and I have not received that. It sounds like you are probably with us, and if you are, please send an email to evv@cdsintaxes.com. Attention it to me, Kevin, and we'll make sure we expedite that. I do know that there were some issues with that email going to spam or being bounced back. I want to make sure that we do some investigation to work with Vesta on that. So please send an email to us. Next question is for Vesta app. How do we learn service attendant IDs? So that's a great question. You can either work with your FMSA, they have the ability to give you all that information, or if you have access to Vesta Web, or also known as CDV, you can actually log in and go underneath the profile section. And at the very bottom, it'll show all the members that are assigned to you or responsible for. And if you click on that and scroll down to the bottom, it will tell you every one of your service attendants IDs and their punching in and out information so you can provide that to them. Next question is, can we use an iPad for everyone to use and just have them sign in and out with different usernames? Absolutely. We have actually heard this quite a bit, that they're going to get a designated iPad within the home. And at that point, that iPad will become where the employees will clock in and out. Kind of like where you have a punch card when you go into a place of business. It's centralized and employees know that they have to clock in and out there. Absolutely, that is actually a great idea, and we've heard quite a bit. We actually have another email saying that it's from the same individual about saying it's been 3 weeks, haven't heard anything from Vesta. Again, please send us an email. We'd be more happy to isolate this incident and try to track down and see what's going on. Individual says, our FMSA is not requiring timesheets now. We are already using Vesta. Now, whatever your FMSA is choosing to do, that is up to them. We are not doing that because there's not been an official statement from HHSC stating that we can stop using EVV. And from a contract monitoring perspective, we are still required to produce those in the event that someone wanted to review the services and how they're being utilized. So our FMSA, we are choosing to still require timesheets. And we are waiting for guidance from HHSC as far as program roles, as far as how it's going to look once EVV is implemented and actually gone live. So your FMSA has chose to do that. That's on them. You may want to have a conversation with them, but that is obviously a decision that they're making. Next question is, how can you match the exact hours that employee clocked in and out with visit maintenance? I'm not sure exactly what you mean by the question, but whenever you log into the visit maintenance system, you will see a list of all the punches that are required using an alternative device, a mobile app, or calling in from a landline. And you'll see all those, and you can filter by service, you can filter by date, you can filter by employee. And then at that point, you can go in and add your manual visits within there to build your virtual timesheet. But as far as matching the exact hours, you can put the exact hours that your employee clocked in and out, even if you do a manual visit. Next question says, my son lives in his own home because of COVID. Are there any videos I can use to train my staff? I do not want to have one-on-one contact with him. Absolutely, there are visits and videos that are available through the EVV vendor system. I know Vesta does have several videos that are available, and we also have several videos that we can also provide as well, but also documentation. Again, if you are with us, you can go to cdsintexas.com. You can also email evv@cdsintexas.com. If you are not with us, there are videos available. Contact your FMSA for access to those. Next question is, are videos in Spanish? As of right now, some of the forms are being translated into Spanish, and they are working on training material that is in Spanish. But as far as videos being in Spanish, unfortunately, there's none to my knowledge at this point. Okay, so we're going to go back to the FAQs.
Okay, how will holiday and vacation pay work with EVV? Vacation and holiday pay are not EVV required services and will need to be communicated on a separate form. That's money dealing with your budget that's been set aside. So vacation, holiday, you're still going to send in a timesheet to get those paid out to the employee. EVV has not officially gone live. Please continue to submit these types of items on your employee's timesheet. Once EVV usage has begun, we will have a new form to communicate and document services that are not EVV services. I do not want to use EVV, so I'm holding off on sending in the requested paperwork. EVV is not an option any longer for CDS option. Please make your selection on Form 1722 and return it to your FMSA.
And to speak to that, we're actually getting quite a bit of that where individuals are frustrated, and we understand completely where the frustration is coming from. Unfortunately, it is a federal requirement, and the state will lose Medicaid funding from a federal level if they don't comply. So unfortunately, it's not an option. But what I would encourage you to do is work with your FMSA, have a conversation with them about which option fits your needs the best, and make that decision. But yes, as April stated, it is no longer an option. Please get your form in as soon as possible, so at least you can be ramping this up during the practice period versus a short timeline when things have actually gone live.
On Form 1722, what do we put as an effective date? The effective date needs to be the date you signed the form. So the day you're signing it and sending it to us.
So next question we have is, so if you have an alternative device, you request a code from it, and that employee then inputs at the appropriate time, or do you have to request the code at the exact time the employee arrives or departs? So the way the alternative device works, or a token, it's got a randomized number that goes through a sequence. Whenever your employee clocks in, they need to write down that code. Whenever your employee clocks out, they need to write down that code. Because since it is an algorithm and it's a series of numbers, when they write down that code, it tells the system who the member is, what time that they're clocking, what date they're clocking in, and the time that they're clocking in. And it cycles through that. That's why it's only good for 7 days, because there's so many numbers, there's only so many numbers available on that token itself. So to answer your question, you need to write down the code when the employee clocks in, and you need to write down the code when the employee clocks out. You can submit that code by calling in a 1-800 number, entering it into the mobile device, or you can also enter it into the web interface that you use to do visit maintenance. So having your employee write it down is the first step. And at that point, after the shift is over, calling those codes in or entering those into whatever device you're using. So next question, it says, I'm confused. So if I have 3 children in the home, do I need separate devices for them? Is there a way I can talk with someone at CDS and different services to see what would be the best option for us? If you're with us, absolutely. Send an email to EVV at CDS in Texas. You can address it to myself, or you can contact our customer support department, who has become very proficient at answering EVV questions over the last 2 to 3 months. And we'd be more than happy to assist you in any way. But to answer your question, as far as if you have 3 children at home, you need separate devices. Yes, you would need separate alternative devices because they're coded to meet that member, to be compatible with that member. But if you're using a mobile device, no, you can use one mobile device and you can select the difference in a drop down between which member that they're providing services for. All right, I'm gonna have to sit through these, so we're gonna go to the next slide.
Okay, another question. I heard if my employee lives in the same household, I do not have to participate in EVV. Unfortunately, this is not the case. CMS recommended that a state can exclude members from having to participate in EVV if their employee lives in the same home as the client. Texas HHSC has decided not to adopt this recommendation, and all personal care employees must utilize EVV. Employer wants to know if employee can take the training course instead of the employer for EVV. No, the employer or their DR must be the one to take the EVV training. The employer then trains the employee on how to clock in and out.
So the next question that we have, it says, I've heard somewhere that EVV would also require to take a photo of the individual, be taken and submitted at the time of clock in and clock out. So that is biometrics, and the state of Texas has not taken that as one of the clock in and out methods or one of the requirements. So that is false for the state of Texas. It may be true for another state, but Texas, that is false. Another question says, how do we get training for EVV? Again, whenever you first get your username and password for your EVV system, there will be required training that you must complete. There's also HHSC EVV training as well available. I don't know which FMSA you're with, but if you're with us, you can either email us at evv@cdsintexas.com, or you can go to cdsintexas.com, and we have FAQs, links for training on our main page. It's a pop-up at the bottom right where it gives you a downloadable link for all those.
I see a question in the chat from I believe one of our clients. Will you continue to still receive payroll reports? Yes, you will. Nothing is changing as far as how your employee is getting paid, how you're getting your reports from us on usage. None of that's changing. The only thing changing here is how you're recording the time in and out for your employee. Everything stays the same with us. So your direct deposit, all of that stuff stays the same.
So the next question says, my client has both HAB and respite services. Can the attendant use the same alternative device to clock in and out for both services? Is there a way to distinguish these services on the device? The pay rate is different. So you can use the same device to clock in and out for the services, but unfortunately, there's not a way to distinguish between which service is being provided. So what I would encourage you to do is whenever they write down the token number, when they clock in, they put the service out to the right. And then, of course, you'll write down the corresponding clock out. And when they clock in for the other service, write the service down to the right. So whenever you are doing your visit maintenance and they're entering their codes, you can select the appropriate service. But yes, that is why we are encouraging everyone to try to utilize the mobile app if you're capable or if you're able to do that, because it eliminates a lot of visit maintenance.
thought I saw Vesta had Spanish videos today in the employer app.
So Vesta does have, next question is, can you provide the links, are they in Spanish? So for training. So Vesta does have some printed material that is in Spanish. Now, obviously that's pertaining to Vesta, and we do have access to that. So if you're with us, please email evv@cdsintexas.com or call us, and we can make sure we give you as much material as possible in Spanish. And we do have that available on our website as well in Spanish, where you can download that. There's another one that says, I've sent my form to my FMSA. Is that y'all? I'm not sure if you are with us or not, but if for some reason, if you do have some concerns, if you are with us and maybe a form hasn't been processed or not, you can either email us at evv@cdsintexas.com or call our customer support department. We'd be more than happy to help you with that. Next question is, what is your response to concerns over the EVV system tracking participants coming and going and potential lead to putting them, the employees in danger? So with the apps, it does document your location upon the punch in and the punch out. There's been strict rules centered around HHSC's guidance on how the apps are developed and how they review the app and how it functions. And one of the requirements is it is not allowed to do any tracking outside of documenting the punch in and punch out location. So one of the common misconceptions that we are hearing a lot is that it's tracking you constantly on the back end. The app developers have been instructed to that is not allowed, and that it should only document the punch in and punch out locations. So another FAQ that we have, it says, I have a voice over IP phone, also known as VoIP. Home phone like Magic Jack, OMA, is this considered a landline phone? Non-fixed voice over IP or VoIP are now allowable phone types if the client's home phone is not a hardwired landline. So there is an approved voice over IP list. We do have that available. The state has that available. Where you can utilize those. And we have that on our FAQ, that list on our website. But you can technically use voice over IP as a landline to clock in and out. The EVV information form requests that employers select a phone option and ask the employee's phone and email. Is the employee clocking in and out on their phone, landline, or ER phone? The employee cannot use their own landline phone to clock in and out. They can use their own smartphone to clock in and out, or calling in a code generated by an alternative device on any phone. But yes, they cannot use any landline other than the one that is at the primary place of service. So we're going to go back over to the questions. So if an employee travels out of town or state with us using, will they still get paid using EVV? So EVV is only meant to communicate how services are being utilized. It's not meant to change any way that the services are being utilized. So what that means is if you're traveling the state, within the state of Texas, you would continue to clock in and out. If you have the mobile app, there would be no difference. If for some reason, if you don't have the mobile app, but you're required to travel, you would then need to document doing on a timesheet and do manual entry whenever you return home, or whenever you get to a spot to communicate that to your FMSA. But as far as traveling out of state, I would encourage you, as you probably already do, is communicate with your service coordinator. But as far as EVV inhibiting your ability to utilize your services, it is not meant to do that. It's only meant to document what you're doing. Another question is, sometimes one employee will drop my son off at an appointment or class and another will pick him up. How does GPS on the EVV system work? It's time bumped. Is time bumped it start end at the location where the client lives? So I actually asked this question this morning in an EVV meeting with HHSC, It is only meant to document where the services are beginning and ending. It doesn't have to be within a region or geographical region within the home. So that means while they're in the community, you would clock in and out. It would simply do a quick document as far as where the punch happened and where the punch out happened. But there is no restrictions as far as where it's happening in the community. So another question says, in the mobile app, can you distinguish between HAB and respite services? Yes. So as of, speaking of Vesta, so let me clarify, speaking of the Vesta mobile app, as of October 1st, they will be publishing a new version where it will allow you to distinguish between services that are authorized for the member. So moving back to the FAQs, is there a mileage limit for employees when attending doctor's appointment? No, EVV is not limiting any services. It is only records the time in and time out. Mileage is not subject to EVV. If you have transportation as a separate authorized service, that time must be recorded on a timesheet. It is not part of EVV at this time. So kind of recap, it is not meant to change the way you're utilizing service. It's only meant to document those of how you're doing it. So therefore it can be sent to the state. But as far as transportation, it is not a EVV required service. Can the designated representative sign the EVV documents for the client if he or she is unable to do so? Yes, the DR can sign the 1722 if the effective date on the as of the effective date on the 1720. So what that means is that they can sign as long as the date on the 1722 isn't before the date of the 1720. So pretty much that means it has to be before they're appointed as your DR. Next question is it a problem for a client and employer to use the same email and phone for the EVV forms? The only issue with this is that I would encourage the client or the member to have their own email address for receiving documentations, for password resets to their visit maintenance system. I would not encourage an employer to share with their employees how to do visit maintenance. As far as for the Vesta system, the employee's email address is not used for clocking in and out. So technically we can bypass the email field for the employee within the system. But as far as the client utilizing the email address and the employee, I would not recommend that. So the next question says, what's the difference between family home and member home in the visit location? So whenever you have the drop-down box in the mobile app, it asks you as far as if it's a neighbor's home, a family's home in the community. All that is just a list of options that you can select between as far as whenever you are out and about in the community. It doesn't have any bearing whatsoever on how services are documented. It just simply, or not documented, but compliance. It's not meant to inhibit as far as how you're utilizing it. It's simply documenting where you are within whenever you're providing those services. So if you're in the community and it's tracking a GPS upon clock in, you simply say in the community. If you're at your home, you simply would put it at your home when you clock in and out, but it's a drop-down box within the mobile app. Next question says, does the system allow the grace period or overlap time to be paid when two workers change shifts? There needs to be a sharing of knowledge between two workers for the health and safety of the consumer. So the overlapping of a shift goes into sometimes the program rules, and also EVV is not meant to restrict that. EVV will allow you to do so. But if there's an overlap, you want to make sure you're discussing that with your FMSA and with your service coordinator, because some programs do not allow that. But I understand what you're stating as far as the safety of the consumer. I would just encourage you to have a conversation with your FMSA and your service coordinator just so they know that the overlap is there and they can account for it. But the EVV system does allow it, and it will not keep one from clocking in when the other one's clocked in. So this question says, why isn't forgot to clock out a choice under reason code? Other doesn't seem sufficient. So there actually is. So actually, to go back just one step in regards to the grace period and clocking in and out as far as overlap, please communicate with your service coordinator, because it's actually not, it's not allowed as a general rule. Sometimes it is allowed by the service coordinator if it's an exception as far as overlapping shifts. So just to clarify that, so if I confuse anyone, I apologize. So back to the forget to clock in and out. There actually is a reason code that says the employee failed to clock in, employee failed to clock out, and a third that says employee failed to clock in and out. And that's actually a reason code that's on the reason code list. I'm not sure which system you're using, but if you're using Vesta, it's at the very bottom of the reason code selection.
Let me read that through chat.
Yeah, actually, we just went through this one. I'm going to go to the next one.
Okay, yeah.
Oh.
Okay.
So we're gonna leave the helpful hints up, and we're gonna close with that, but we have a couple more questions to get to. So next question says, appreciate the directive given to only record location at clock in and out with EVV. What measures have been put in place to prevent hackers from getting access to this information, so as to prevent hackers from putting a pattern of movement together on the participant? So I cannot speak to the app developer for each vendor system, but I do know that with the development of the business rules with HHSC, TMHP, and the vendors, that they have put rules in there as far as a minimum requirement for development of software and applications. So that would be a question for the EVV vendor's application, which each EVV vendor has a customer service number, and they are required to answer questions from CDS employers and FMSAs. And that would be a great question to ask them. Yeah, so the next one is that they're asking for clarification for the difference in a family home and a member home. I guess a member home would be the individual receiving services, and a family home could be a grandmother, an uncle, something to that nature. Why it's illustrated like that on the mobile app as far as an option, I do not know, but they're asking you to differentiate between a member's home or a family member's home, or if you're in a community. So. Okay.
So on this slide that you see, we've kind of picked up some helpful hints throughout this whole process. And listening, I heard a good one that's on here last year from a company out of Washington that's already been doing EVV for a year or two. So what they had done, the employers, they suggested their employers make a card for each employee with the client. They're going to have a unique number for EVV, and the employee has a unique number for EVV to clock in and out over the phone or through the mobile app. And it's just a card you keep in a common area in the home, or the employee can keep it on them, maybe on a lanyard when they come home, when they come over to the house. Make each employee an EVV card with the individual's code and the employee's EVV code with EVV phone number and app information on it. This could be kept in the home by the landline or common area that timesheets were filled out. Another helpful hint is set alarms. I know on an Apple phone, you can go to your alarms and you can rename the alarms that you set, and maybe put clock in, clock out to help the employee, or you remind the employee to clock in and out. at their in and out times. Another helpful hint is if you maybe have a Google in your house, a Google Home, or one of those Alexas in the kitchen or wherever, you can ask it to set an alarm for you whatever day of the week, and it can go off or just make a little noise to remind you to clock in or clock out, or maybe even set one every Sunday for you to remind the employer to go in and do visit maintenance in the EVV system. So those are just some helpful hints. If we would love to hear any other ones that y'all have, just so we can pass those out to people to make this easier for everybody.
Yeah, and just so you all know, any question, we appreciate it being asked, and because what we're doing is we are compiling a list of frequently asked questions on our internal servers in order to create PDF documents to send out to clients. So if you have a question, please feel free to ask it. Send it in to evv@cdsinTexas.com. If you're with us, call our office. They also have a way to submit those while you're on the phone. But we are taking that information and we're creating a frequently asked question that hopefully is filled with useful questions of individuals that actually are utilizing the service versus just something that we thought up in a back room. So if you would like that, it is downloadable at cdsinTexas.com. Like I said, at the bottom right of the screen, you can click and download that FAQ. And hopefully it's helpful. If there's questions that are not on there, please submit them so we can continually grow that. So we have a couple more minutes and we have just a couple other questions coming in. So it says your recommendation for CDS clients to use option 1 or 3 on 1722. Yes, ultimately we can't make the decision for you if you choose to go with option 1, 2, or 3. But from what we are seeing is that between option 1 and option 3 is the less back and forth between the two systems, between the FMSA and the CDS employer. Option 1 meaning that you would be the one putting the time in, you'd be the one approving it, and we would validate it and send it to TMHP and then process payroll. Option 3, you submit a timesheet to us. We see which employees clocked in and out and which ones didn't. We put that in. We communicate to you your employees who are not clocking in and out so you can work with them. And then we submit that to HHSC TMHP and we process payroll and move forward. So yes, we are recommending option 1 or 3, but if you feel option 2 meets your needs, that is your decision.
Hey, Bonnie, thanks for that tip. Bonnie said that on the iPhone, in the Shortcuts app, it allows you to set up automatic text messages to be sent at certain times of the day. That's a great idea. Thank you.
Wow. Thank you guys so much, April and Kevin, for being so thorough and really helping our families understand. I think there were so many great questions, and I hope that everybody on the call was able to get some good information, whether they're with CDS in Texas or now they know what to go to their FMSA and ask questions about. So thank you guys for being so thorough and for being here. We will have the slides up on our website at txpp.org in the next couple of days. As to the recording, I will have a conversation with April and we'll determine whether or not it will be up there. If we're able to put the recording up on our website, it will show up where the handouts go. So everybody, thank you so much. April and Kevin, I cannot thank you enough for sharing all this wonderful information. So everybody take care. I put a link in the chat box. If you can fill out the evaluation, we greatly appreciate it. We will also follow it up with an email with the link just in case you missed it.
Thank you all.
Thank you.
Thank you guys so much. Bye, everybody. Thank you for being here.